Good evening and a very warm welcome to everyone. I am Neetu Abraham, Community Manager at MediSage, a platform made by the doctors for the doctors, created to foster continuous knowledge sharing, meaningful learning, and professional collaboration. On behalf of MediSage, I am delighted and happy to welcome you to SexMed Connect to Sexual Health Ki Pathshala, where today we will be discussing on the topic mindfulness therapy in sexual dysfunction. Now, I would like to invite Dr. Shama Sultana to carry forward the session. Over to you, ma'am.
Good evening, everyone. I would like to share the screen. So, as we have known that SecMed Connect is a forum for gynecologists to share knowledge and gain knowledge. So, we have various platforms like WhatsApp, Instagram, and Facebook where we post our updates. So, today's Sexual Health Ki Pathshala episode 3, we are focusing on the topic mindfulness therapy in sexual dysfunction. For this, we have a faculty Dr. Shivkumar Gundeti sir. He is a senior consultant. He is currently working as an associate professor and HOD, Department of Clinical Psychology, the Apollo University, Chittoor, and various places he is working as a consultant at Hyderabad, Karimnagar, and Hanumkonda. Dr. Shivkumar Gundeti provides a wide range of psychological services that include psychodiagnostic evaluations, individual psychotherapy, cognitive behavioral therapy, interpersonal psychotherapy, solution based brief therapy, family and marital therapy, sex therapy, neurocognitive retraining, and de addiction therapy. Over the course of 16 years as a teacher and practitioner, he has developed extensive expertise in managing depression, anxiety, obsessive compulsive disorder, panic disorder, and dissociative disorders, while also addressing teenage adjustment issues, marital and relationship difficulties, and male sexual dysfunctions. His clinical work further extends to the treatment of substance abuse and stress related conditions. Dr. Gundeti's approach is integrative and client focused and aiming not only at symptom reduction but also at fostering emotional resilience, healthier relationships, and long term psychological well being. So, as 16 years of professional experience as a licensed practitioner in the field of clinical psychology, now we welcome you, sir, to give us an expert talk and clear our queries on mindfulness therapy in sexual dysfunction. We welcome you, sir.
Thank you. Thank you, Dr. Sharma. And thank you, Dr. Neeraj, Dr. Sharma, Dr. Yogita, and Dr. Naisargi and Neetu.
Welcome, sir.
Thanks for very heartwarming and beautiful introduction and kind words about me. And thanks for presiding for today's session. Okay. Let me quickly present the PPT. Well, so mindfulness. Before I get into the talk today, I want to present a few real world scenarios today. We are witnessing many incidents around us, like people are not really into what they are doing. We may be working, we may be eating, we may be doing many routine tasks, talking to a friend, attending to a class, working, driving, and so on. But people find it difficult to get engaged with what they are doing. They are not engaged into what they are doing. Instead of being present in what they are doing, they may be mostly, like most people, are pulled away by certain other unnecessary aspects of life. Okay, minds are elsewhere while performing their daily routines. Instead of being in present, minds are full of something else that may be probably fantasies, worries about future, distressing thoughts about what has happened in the past, or about future apprehensions, and so on. So these kind of thoughts, they constantly drive people away from what they are doing in the present moment. This state, what I call mindfulness. Mind is full of something which is not needed to be present here. A cluttered mind which really robes away our awareness and disconnects from our present life. Life is meant to be lived mindfully, which means being in the present. because only when we are in present, we will be able to experience the emotions, what is happening over there. We can sense what is going on there. Learning happens, and we can use it uh, uh, for our future activities. But however, in most sexual, in most cases, people find it difficult to be present. Okay. With the digital advancements, there are mobile phones and iPads and laptops in everybody's hand. Maybe they are driving, maybe they are talking to a friend, maybe wife and husband sitting and discussing over something. It's a usual complaint that husband or wife is preoccupied with something else over their phone. So this is called, it is not like, you see, it is not being in the present. It is mindless. There is no mind in what they are doing. So life is meant to be lived in a mindful way. Only then we can have enriching experience of life and we can call it life. So now the same thing is happening to clients with sexual dysfunctions also. Most clients who come to my clinic, when I try to kind of evaluate what's happening and all, they report that they are going through certain anticipations as they are kind of planning to be intimate with their partner. They have anticipations or worries or feeling of shame based on the past failures. They have all those kind of disturbances in their mind as they want to be intimate with their partner. So these distressing thoughts and worries basically hijack client from the present situation, and it pulls away them from the intimacy. It disconnects them from their bodies and from their partners and the whole present moment itself. This is why mindfulness becomes an important tool in sexual health. It helps for the clients to be in the present with complete awareness and complete connection with life. So, sexual functioning as such is not a very simple thing. It's a very complex process. It is very dynamic process, and it is shaped by interaction of biological, psychological, relational, and socio-cultural factors. All these factors play a very important role. What do clients know about sexuality? What are they aware about their biological processes? How is the relationship with partner? And socio-culturally, like you see, what kind of expectations are set? All these things matter in framing a healthy sexual functioning. So many sexual difficulties are primarily viewed as physiological disorders. But however, there is an increasing clinical evidence and understanding which recognizes that sexual difficulties or sexual dysfunctions are caused by or sometimes maintained by psychological processes such as anxiety, shame, performance related worries, negative beliefs, not being able to pay attention, we call it attentional problems, and not being able to regulate their emotions in a better way. We call it emotional dysregulation. So these psychological factors not only interfere with sexual responses, but they also often become self reinforcing through cycles of fear, avoidance, and failure and shame also. So, over the period of time, mindfulness has evolved as a beautiful method, okay, and a powerful tool which integrates, okay, sexual health with the mindful practices. It is rooted in ancient Eastern traditions and which is adopted into modern psychotherapeutic practices. Mindfulness offers a wide range of methods which can help people to relate differently to their inner experiences. So rather than attempting to control their physiological changes, or suppress them, or correct their sexual responses, mindfulness cultivates a present moment awareness because this is something very important for anybody to achieve the best sexual arousal, or like you see, to be able to have a satisfactory sexual intercourse or to have a better outcomes. So Mindfulness helps individuals to disengage from maladaptive cognitive processes and emotional disturbances, and helps to reconnect with the bodies in a better way, with the partners in a better way, and able to manage their desires in more neutral and compassionate way. It's a move from east to west. Initially, when cognitive behavioral therapies were introduced, the first generation cognitive behavioral therapies were mostly on the stimulus and response connection, which means when a person is scared, okay, person is scared because of presence of something, okay. It may be because of a snake or because of a dog, because of something. There is a stimulus, and a person is responding to that stimulus in this way. But second generation cognitive behavioral therapies emphasized on the role of thought processes. What individual thinking matters, because not everybody is scared of snake, not everybody is scared to drive in traffic. Something is happening in the individual. How individual is seeing himself or herself matters a lot. What thought processes, what beliefs, what assumptions do they have? So, second generation cognitive behavioral therapy has largely focused on restructuring the thought processes, debating the thoughts, arguing with the thoughts, and replacing maladaptive or distorted cognitions with more of appropriate cognitions. But that too did not yield satisfactory outcomes, like you see in terms of maintaining the outcome. That is where a shift happened from Eastern approaches of cognitive behavioral interventions introduced by Dr. Albert Ellis and Beck to the Western philosophies. Mindfulness approaches were originated from the Buddhist philosophy, from the teaching of Buddha in Satipatthana Sutta. This is the doctrine of Buddha. It describes that cultivation of awareness of body, being aware of bodily sensations, our feelings, our mind, essentially our thought processes and mental phenomena. These are very essential to understand. This is called mindfulness, like you see, being aware of body, our feelings, our thought processes, and our own view of our mental phenomena. In this tradition, mindfulness was not developed as a technique for symptom removal. There are behavioral interventions, relaxation methods to reduce anxiety. There are a few breathing relaxation methods to reduce physiological arousal and autonomic arousal. But mindfulness did not evolve as such a method to reduce the symptoms. But when Buddha taught this mindfulness, it is all about understanding the nature of suffering. Okay, why people suffer and how to liberate from that suffering. It has a very deep philosophical meaning. So, in Buddhist philosophy, suffering was understood to arise from overly attachment to pleasure. When people want pleasures, overly attached to it, when that don't happen, people feel unpleasant and distressing. So now, what is that we are wanting to happen? What is that which is possible, which is permanent, which is not permanent? Understanding these things is very important according to Buddhist philosophy. So, ignorance of our own mental processes, what we are longing for, is the cause of suffering. So, according to mindfulness in sexuality, if we see how mindfulness can explain this sexuality, how it can help sexuality, we can understand this way. Distress, when couple are in distress, this often emerges from outcomes to attachment, overly attachment to outcomes. Okay, I would be happy only if I could succeed. Okay, only if I satisfy my partner. Okay, so when there is an overly attachment, okay, it will lead to, like you see, anxiety and stress. So when this, most of times these outcomes are about performance, orgasm, adequacy, right? And this will form aversion to vulnerability, uncertainty, or sometimes emotional exposures also. So mindfulness was introduced to Western psychology, okay, by John Kabat-Zinn through his works on mindfulness-based stress reduction techniques. It was reframed as a psychological method, though it is philosophically rooted. When John Corbett worked, he viewed he when he introduced it in the stress management, he called it mindfulness-based stress reduction technique, and he introduced it as a psychological method rather than a spiritual discipline. This paved way for its integration into different other psychotherapeutic approaches. In cognitive behavioral therapies, we call mindfulness cognitive behavioral therapy, MCBT, acceptance commitment therapy, dialectical behavior therapy, and compassion focused therapy. These approaches are often referred to as third wave cognitive behavioral therapies because they have moved beyond the content of thoughts. Second generation of cognitive behavioral therapies have focused mostly on the content of the thoughts. What is that thought about? What does it contain? Okay. But third generation has moved out of this content of thoughts and started focusing on changing the individual's relationship with their own thoughts, how individuals are connecting with their thoughts, emotions, and bodily sensations. So this is how mindfulness can be, like you see, relevant. And moving further, how this mindfulness perspective can really help in improving sexuality and say treating sexual dysfunctions. Generally, sexual response is largely involuntary. When a person gets sexually aroused, they may be, like you said, most of the times it may not be voluntary, it is involuntary. Some stimuli will be mediating through the parasympathetic nervous system, leading to vasodilation and increased blood flow to genital tissue. Anxiety reduces, muscle tension reduces, and it will facilitate arousal and erection in men and lubrication in women. So, this kind of state is really necessary for being intimate and having penetrative sex and having pleasure in that relationship. However, excessive monitoring, clients with repeated sexual failures will tend to monitor, have that control. I should control my erection. I should delay my ejaculation. All these kind of control and evaluative thinking. Am I doing well? Am I losing? What is my partner thinking? So these kind of things interfere with the process and it will lead to activation of parasympathetic nervous system. Activation of sympathetic nervous system. A person's parasympathetic nervous system needs to be mediating these sexual responses, but being preoccupied with such negative aspects of mind or thought processes, past failures, will lead to sympathetic activation. So when this happens, it will disrupt the sexual response cycle by triggering stress and all the changes which are necessary for achieving erection or achieving lubrication will kind of vanish in a split second. It will lead to vasoconstriction, heightened muscle tension. It will inhibit sexual arousal, reduce genital blood flow, and it will interfere with erection, lubrication, and delays orgasm. So mindfulness will help clients to step out of this performance-oriented mode. As long as the person is monitoring this performance, trying to control, they are in this performance-oriented mode. As they are more and more engaged with this kind of mode, they will see repeated failures. So mindfulness helps people to shift their focus from this performance-oriented mode to an experiential mode, thereby removing psychological obstacles to the natural unfolding of sexual responses. Then the sexual response itself will happen very normally. So, sexual health or healthy sexual life involves a very relaxed arousal and emotional openness and sensory awareness. So, these are the very prerequisites to have a very safety sexual life and happy sexual life. I want to share a case example here. I'm recently treating a couple who is married just for 3 months. What happened is it's an arranged marriage by parents. Both are well educated, software engineer. Her wife is a software engineer, and her husband too is a software engineer. They have very good packages. So everything found well, horoscope matched. Everybody felt they are a perfect match. So marriage was performed. As marriage was performed, some discussions were happening, how to perform, what to do, what arrangements need to happen. So girl side, boy side, both of them were engaged in discussions. And husband's paternal aunt happened to speak something which kind of offended girl's parents, and they were utterly disappointed. After going home, girl's parents discussed, okay, how she can talk like this. She is like, you see, very dominating. Okay, she has insulted us. All these things. These are natural discussions, normal discussions which happen in family when something doesn't go well. But they kept all those things away. Marriage was performed. Things went well. This couple was sent to Bali for honeymoon, 7 days trip. So 2 days went well. They were happy. They were having, like you see, good intimacy and all. No complaints. Girl is happy. Boy is happy. The third day, when they were relaxing, okay, walking on the beach and all, they were talking, like you see, how marriage was performed and how things went on. Girl happened to suddenly recollect these experiences which were distressing to her, and she just spoke about those things to husband. Okay. When husband is generally an anxious person, he who kind of tries to brush away these kind of conflicting talks. So he was keeping quiet, and one moment. He was keeping quiet, and after a point, she became very angry. When she became angry, she started kind of shouting on him. You're not understanding my emotions. How can you kind of neglect me? Mm. So all this emotional drama happened. This kind of shocked husband because 2 days went well. Even from the marriage, it was only 7, 8 days. Every day went well. But when these arguments happened, he was very disturbed. Somehow they managed to end that conversation. They went to their hotel room. They kind of relaxed, have an early dinner, and they want to spend some intimate time. So as they are being intimate, husband is not able to kind of focus. He is disturbed by those arguments. He is an anxious person. For anxious people, they kind of keep on worrying, preoccupied with what happened. When something distressing happens, anxious people, they kind of overthink that. And he is in that loop of overthinking, which has, like, you see, led to poor attention to what is happening there. And when they both were trying, he was not able to achieve proper erections and he failed. Okay, he was not able to participate in penetrative sex. Then it was shocking to him, it was shocking to her because all these days things were going well, but suddenly this did not go well. Husband felt a little shameful because it is sexual functioning in male is always associated with ego. If something don't go well, they are deeply hurt. So husband was deeply hurt, and they tried next day, but this performance failure, okay, because he is preoccupied worrying about the same failures, worrying about the failure, not be able to pay attention. He failed repeatedly, and that trip ended. They came back with a lot of distress. After coming home, when she was trying to go close to him, he is avoiding her. When she is making some sexual advancements, he is pushing her away, which is very hurting to her. After 1 month, she reported to her parents. Once she reported to her parents, you know what happens? Hmm? Girls' parents, they are also a little emotional. They immediately rushed to boy's home, husband's home. They kind of reported everything to parents. All traumatic things happened, which kind of put a lot of shame, a lot of guilt, a lot of anxiety, a lot of demand on husband. Finally, it was decided to take him to an andrologist to check him whether he is fit or not, because they are blaming him to be impotent because he is not able to do. So they took him to andrologist. all routine tests done, and he found to be physically fit. And the andrologist said maybe it is because of performance anxiety he is feeling. He needs some counseling. So both of you go and take counseling. He will be all right. But girls' parents want to know how many days it will take. He will be okay in a month or 2 months. What is my girl's life going to be? All these things have put a lot of demand on the boy, on the husband. See, sex is not always very satisfactory or pleasant to many people. It is sometimes very unpleasant. It is a kind of test of adequacy, place of shame and blame, like this, right? And this will lead to a lot of apprehensive thoughts. Patients, they tend to constantly evaluate their own performance. Okay, they keep on observing. Okay, am I getting aroused? Why nothing is happening to me? Why I am not achieving erections? So all this constant evaluation of performance will only worsen the performance, worsen the arousal, worsen the act itself, because that is driving away the person from what act which is happening there. So it leads individual to monitor their responses. It only causes them to monitor their responses rather than experiencing them. When there is a beautiful wife or a husband in front of them, okay, so there is a lot of pleasure in doing few things rather than focusing on incoming pleasure or wife who is present there. Okay, it will lead to fluctuations in arousal. So mindfulness will help people to understand this pattern of thinking. When patients tend to think in these negative loops, okay, they will lose the present moment. So mindfulness encourages a very non-striving and non-effortful kind of attitude, which allows desires and pleasures to emerge gradually, being in the present, just experiencing the incoming stimuli, sexually arousing, whatever it is, okay, and experience that pleasure. And that is how gradually the sexual responses can be shaped more naturally and organically. Through mindful practices, partners can reconnect with their bodies, not in a way to be judged or controlled, but as living sources of sensation, emotion, and connection by being in the present moment. So this transforms sexual experiences as a goal-driven activity into a process-oriented. So now, as the client is experiencing the stimulation, okay, minute by minute, they are only in the present. They are not worrying about what is going to happen. They are not focusing on that goal, but rather focusing in the present. Okay, at present, what is happening in the relationship, and they are embodied and they are embodied, and they will focus on the lived experiences. Mindfulness based approaches or perspective explains sexual dysfunctions are not just seen as a failures of sexual responses. Mindfulness based formulation discusses that significant disturbances in awareness, okay, where is the attention going, what is the person is feeling, whether safe or unsafe, and poor self relation, okay, how the person is connecting to himself, his thoughts, and the responses inside body. So these are very significant in causing sexual dysfunctions. Attention is frequently hijacked. Whenever there is a sexual dysfunction, attention is frequently hijacked by worries about failures. They keep on worrying, ruminating. Comparison with others. When people fail, they may ask their friends, any close friend or a relative, okay, they may ask how long you do. We do it for 20 minutes, half an hour. This person hardly stands for 2 minutes. Okay, then that becomes another worry. How am I going to be perceived? And anticipation of negative outcomes increases. What if I fail again? What if my partner is not satisfied? Okay, I'm expected to prove in a week. Okay, but nothing is happening. What will happen to my marriage? So all these things, all these kind of thoughts will create a lot of panic and anxiety. Naturally, when there is anxiety, attention will not sustain. So, this displacement of attention suppresses sexual arousal, pleasure, by pulling away attention from the awareness of the bodily sensations. It distracts from the incoming sexual stimulation from the partner. It always, like you see, the dysfunctional thoughts in the mind will create a lot of, like you see, emotional distress, anxiety, and it will heighten the sympathetic arousal or autonomic arousal. This is called cognitive fusion. Okay, this intensifies distress. Okay, and person treats their dysfunctional thoughts as facts. Yes, I cannot do anything. Okay, I am a failure. It can't get better. Basically, these are thoughts, these are mental events which happen maybe in the frustrating times. But when person is in distress, they take these thoughts at their face value and start believing them as facts. And when this happens, they go through a lot of shame, fear, fear of failures, repeated failures, and it leads to avoidance behaviors. So over the time, after repeated distressing outcomes, person begin to avoid sexual situations, like in my client. Their emotional vulnerability increases and bodily sensations, any arousal will be associated with anxiety. And this conscious and continuous avoidance, as long as they are anxious, they avoid sexual act. And avoiding that sexual act will give them a kind of relief and negatively reinforces this behavior, which maintains sexual dysfunction. Basically, when a person is preparing for sex, okay, right, then there needs to be a parasympathetic activation. But when there is this physiological arousal, autonomic arousal, because of this threatening or traumatic thoughts in mind, person gets into a mode called fight or flight. This happens to all of us when we are in a very threatening situations or when there is some danger.
Sir, you are muted and your presentation has stopped.
Sorry, I think it is. Could you tell me how long it was before it got muted?
Just now.
Just now. Okay, that's okay, sir. Thank you. Because I'm seeing this PPT and I'm not able to see the Zoom window. Okay. So this physiological arousal or incompatible state for sexual arousal. And when person is going through these worries at psychological level, there is a shame-based self-relating. Patient keeps on blaming themselves. They become very self-critical. It creates an internal environment that is not an emotionally suitable state for openness, not able to communicate well with partners or experience pleasure or initiate being intimate. So mindfulness based methods will help understand all these things in a better way, because where is awareness going? Are you aware? Okay, your attention is paid to incoming sexual stimuli, or is it withdrawn by your preoccupations and so on? Okay, and this education will help them to be rooted in realities, in the present ground. So, while using this therapeutic, while using mindfulness-based approaches in therapy, sex therapy, the targets for therapy is to help the client to be more in the present moment, attention, paying attention, okay, rather than what happened in the past, just a few minutes before the patients or the couple got into bed or being intimate. So it reduces cognitive fusion and self-criticalness. It increases tolerance for emotions. Even if there are distressing emotions surfacing time to time, how to tolerate them, how to deal with them, how to change these anxious bodily experiences, and cultivate more safety, compassion, and embodied awareness. So, this is the target of mindfulness based approach. In erectile dysfunction, it is mostly associated with performance anxiety. Most erectile dysfunction clients, the moment they want to approach their partner, okay, they are worried about their performance. Will I achieve? What is going to happen? They keep on hyper monitoring. Okay, what is happening? Why no arousal? Last time I got arousal in a few minutes, but this time, why it is taking more time? This kind of hyper monitoring, individuals become overly focused on their sexual performance. This leads to stress and inhibition only. Mindfulness breaks this cycle by bringing them to the present focus. You see, whether you will achieve the erection or not, that's a secondary thing, but you focus on what is in the present. You have your partner, you have, like you see, you know what to do. So just keep doing. And you see what you just be with what is happening, what is going on, rather than bringing all the past experiences to present or future apprehensions to present. So mindfulness will help to break this cycle. Breath work and body scans will help, and that we will discuss in a few minutes. Premature ejaculation is another problem which is frequently linked to poor impulse control, not able to control their, you see, delay their ejaculations, and diminished interoceptive awareness of bodily cues, what is happening in the body. Mindfulness enhances this awareness by training individuals to notice small shifts in arousal and tension and allowing for better regulation. So, this can be achieved through breath pacing, attention, and it can help in reducing, or like you see, delaying ejaculation and reducing urgency. Low desire is a frequent problem these days. People are, like you see, participating with partner, desire is low. This is because of poor emotional connection with the partner, emotional disconnection. Because a lot of things are happening. People fight, argue. Okay, they have unresolved issues happening for months and years. So there is an emotional distance between couple. So this will naturally reflect in their sexual life. It is not mechanical. Maybe when they are young, okay, emotions have nothing to do, all these failures and all, they can brush it away and they have all that vigor to participate. But as years pass, emotional connection is very important in shaping sexual desire. So when there is emotional disconnection between the couple, it will lead to stress. It will like couple feel disconnected, detached. Even the partner is present, they don't feel that arousal. So the trauma and relationship strain will lead to a lot of issues. So mindfulness addresses these barriers by encouraging reconnection with sensory pleasure, doing something pleasurable to each other, because all the while they are only doing what is emotionally painful to each other. So mindfulness will help them to change this by like doing something which is sensorily pleasurable to each other and be in presence of each other and enjoy the company of each other. Then vaginismus and dyspareunia, these are other conditions where it involves involuntary muscle tension. When there is a heightened physiological arousal because of sympathetic activation, there is a lot of muscle tension all over the body. Okay, it will lead to fear and pain anticipation in vaginismus, and it is rooted in anxiety, sometimes in past trauma also. Mindfulness is a non-invasive method which will help relaxation. It will promote relaxation and bodily awareness what is happening. So this can be achieved through body scan methods and breathing relaxation techniques. And even orgasmic disorders, okay, also commonly associated with attention distraction. Couple may be participating, but attention is not there. They keep on being, like you see, in that plateau state, that excitement doesn't go up, orgasm doesn't happen. Okay, so it is an attention disturbance. So these kind of disturbances can be dealt better when there is a present moment focus. So mindfulness enhances partners to attune each other, create a more synchronized behavior, and fulfilling sexual dynamics also. Mindfulness methods involve breath awareness, body scan methods, open monitoring of emotions and thoughts, sensory grounding, focusing on sense organs, loving kindness and self compassion towards oneself, urge surfing, okay, knowing thoughts that they kind of like you say, they come as a wave and go away. Mindful exposure will help partners to do something which they avoid because of anxiety. Mindful communication, and sometimes mindfulness, when integrated with senses focus, it will yield better results. We'll see these techniques one by one. Before that, like mindfulness based interventions the main aim is to restore the presence, reduce anxiety driven interferences, and re-establish a safe, embodied, and compassionate relationship with partner and have a wonderful sexual experience. So each of these methods, what I have discussed just before, are targeted specifically to each of the sexual dysfunctions, right? In helping them to regulate their emotions better, being more aware, deal with their cognitive fusion, overcome shame, avoidance behaviors, and help in activation of parasympathetic nervous system and brings a harmony and balance. Breath awareness, like breathing is a very powerful tool. When a person is anxious, just sit, take few long breaths, deep breaths, people will feel a sense of calm. So that calmness in physiological arousal reduces anxiety. Breath awareness can be used as a very powerful tool in regulating autonomic arousal, reducing anxiety, and anchoring attention in the present moment. This can be practiced very simply. We can ask clients to sit in a comfortable chair, take a comfortable posture. If needed, they can put their hand on their, like you see, chest, just to sense the breath. And without attending to the thoughts, we ask the clients just to inhale deeply and exhale, deep inhalations and exhalations. Just notice the sensations while inhalation and notice the sensations while exhalation without attempting to control thoughts. Whenever there are distressing thoughts, we ask the clients just to leave the mind, let it wander. Okay, don't do anything with the mind. Okay, right? Mind is a very, very, like you see, tricky thing. The most things that you don't want to think, it will bring in those situations only. Okay, so it is very difficult to control because there is no control. Mind has invented many controls. Okay, today we have like this digital platform, lot of control, right? So all these things invented by mind, but there is no one to, or like you say, organize it better or control it better. So most clients want to control their thoughts because they think thoughts are leading to problem. If I don't get these thoughts, I can perform well. If I don't have these thoughts, I don't have anxiety. So they don't want thoughts. They want to remove it. But the very desire to remove the thoughts will cause those thoughts to come back again and again. So here we help the client to understand this phenomena and just to regulate breathing. Inhale and exhale. When mind wanders here and there, just don't pay attention. You bring back your attention to your breath. So this is a very powerful tool. Practicing this breathing technique will help. Okay, this can be introduced in the very beginning sessions of the therapy. This reduces anticipatory anxiety. Before the sexual activity, clients keep on worrying. But when they just have this deep breathing practice, that performance anxiety or the outcome related anxiety, so that can be reduced. Their panic reduces and they remain in the present because the moment this parasympathetic activation happens, person isn't present. Moment sympathetic activation happens, person is in a threatful mode, emergency mode, flight or fight activation, and this doesn't work the way they want. So, in erectile dysfunction or premature ejaculation, breath awareness helps stabilize arousal. It keeps on, like you see, it keeps the arousal and it prevents escalation into panic and anxiety, which causes to lose the control. So this is a very powerful tool. We can ask the clients to do it every day, few minutes. It is a very easy thing to do. Okay. They can sit anywhere except in polluted environments. They can sit at the comfort of their home or in the office, take 15 minutes break. Okay. Throughout the day, they can practice it because practice can help to reduce that physiological arousal. Next, body scan. The very purpose of this body scan is to enhance interoceptive awareness, which means the bodily sensations, being aware of what is changing in the body time to time. Okay. This includes subtle pleasure sensations as person is attending to incoming sexual stimuli. Their arousal goes up the moment they have these negative thoughts related to their performance issues, their arousal reduces. So, body scan will be a powerful tool in helping clients to understand how when it is fluctuating, when it is changing. Okay. So, when these changes are ignored or suppressed, it will lead to a lot of problems. Right? Attention is slowly guided through different parts of body, noticing sensations, starting from the forehead, muscle by muscle, in the forehead, in the facial region, in the neck, shoulders. So they just scan and relax that muscle. Just scan. If there is any tightness, relax that muscle. So this kind of method will help the client to be more aware when there is tension and how to relax. When muscles get contracted because of sympathetic activation, they do this body scan, be aware, okay, I'm in this state now. So that awareness will help them. And the practice of releasing through body scan will help them to overcome these stress issues. So attention is slowly guided through different parts of the body, noticing sensations, tightness, tension, warmth, relaxation. We will ask the client not to judge why it is happening, not to interpret that it is happening only because of this, because once they start into going into it, they will be preoccupied with their negative thoughts again. So we ask the client to keep that judgments and interpretations away and just do a body scan and release the muscles. Many clients with sexual difficulties mostly disconnected with their bodies because they are always in their mind. Okay. So, but to experience, body is the source. If they are preoccupied by mind, it leads to failure and shame. The body scan rebuilds a neutral and curious relationship with bodily experiences, and it helps client notice arousals easily and in early, recognize these tension patterns whenever there is a floor, a pelvic floor constriction or tightness, release it, reduce dissociation being associated to the present. So this is a very powerful tool. Okay, when person is preoccupied in the mind, a lot of changes keep happening in the body, which is ignored. They only want outcome, outcome, and outcome. Sympathetic activation happens, leading to a lot of stress. So body scan can reduce all that. Next thing is open monitoring of thoughts and emotions by just being an observer. Mindfulness trains clients to observe their thoughts, emotions, and impulses and just pass them as mental events rather than facts or comments. Mind is a continuous activity of thoughts. People experience a lot of thoughts we cannot count. Okay. All these thoughts are transient. These are mental events. They don't stay longer. Even if we are feared, that thoughts don't stay for long. That will go away in some time. So, openly monitoring these thoughts and associated emotions, okay, and understanding that these are only transient mental events rather than commands and truth, okay, is very important. So, this can be achieved by training clients to notice thoughts, emotions, impulses as and when they arise, negative thoughts or kind of like you see feelings of shame, guilt as and when they arise. Okay, just label them gently. Okay, it's a worrying thought. Okay, it is a self criticism. This thought is leading to fear. Okay, so this will allow them to pass without engagement. We ask the client, don't engage with the thought, just label the thought that okay, it is an it is a it is an obsessive thought or it is a worrying thought. Okay, this thought is causing me being self-critical. So just label the thought, don't engage with the thought, because the moment engagement happens with the thought, sympathetic activation happens. So we put this into the client's mind very clearly. So whenever performance related thoughts happen, such as I am failing, something is going wrong with me, this should be seen as only cognitive event. Just label the thought. When person is disengaged or not engaging with the thought, the emotional grip of that thought weakens. That emotion is not produced. Emotion of shame, guilt, anxiety is not produced. So open monitoring reduces shame, fear, and reactivity. It allows attention to return to the bodily sensations and emotional connection with the partners, with their own self in a better way. So this puts in the patient in a less dominated by being like you see self-criticism and more available to present moment experiences. Then next powerful technique is sensory grounding. Sense organs are only the source of experience for us. Okay, what we hear through our ears, what we see, what we touch, what we smell, and what we taste, these only help us to learn. And grounding sense organs means helping the clients noticing sensations received through all these sense organs. As and when, like you see, the clients engage in intimacy, when husband touches or wife touches, when couple touch each other, there is some arousal or some sense happens. When they speak something in a husky voice, or when they say something romantically, it will lead to some reaction in the body, in the mind, right? So all these things can generate an arousal. So shifting attention from analysis, evaluation, outcome, and directing clients' attention towards this sensory experience of touch, warmth, pressure, and the movement is very crucial in shaping healthy or like you say a pleasant sexual outcomes. This helps individual to move out of spectatoring. जैसे कोई like someone is sitting here, most client experience this spectatoring. They are in the act, they also observe themselves how they are doing. So this will only cause them to judge themselves more and more and lead to performance anxieties. So sensory grounding is helping the client to focusing on incoming sensory stimuli. It helps the individual to move out of the spectatoring and be in experiencing it. This retains mind to associate with intimacy, with presence and pleasure rather than performance and judgment. So this supports desire, this increases desire because when a person is only tuned to what is coming in, it causes desire. When there is a beautiful, like you see, wife or a husband, or like you see, some romantic thing happening, person is barely paying attention to it, sense or through his sense organs. Okay, if a person is sitting with movies, Okay, a wife complains. You see, this fellow is always with phone. He doesn't come to me. He doesn't appreciate when I am dressing up in a little romantic way, right? You see, there is no attention. You see, eyes, ears, everything that need to be very active, involved in the present. So when that is lacking, it leads to dysfunction. So we help the client to support, to be in the present ground sensory stimuli, to be grounded in the present sensory stimuli, to increase desire, arousal, emotional engagement with partner, and couple who are particularly feel disconnected will feel very benefited because they are paying attention to each other. For wife, husband is the stimuli. For husband, wife is the stimuli. So they pay attention to each other. Their bond gets better, right? Then self-compassion. Cultivating a kind of accepting internal attitude towards oneself is very important. Another important tool in shaping one's sexual experience. Because if a person is very self-critical, very blaming, carrying that deep shame, okay, becomes very defensive, has a shield in front of him, okay, basically sexuality inhibits. They are not free to express. They can't talk openly. When they themselves have a lot of self-doubt, whether I'm doing it right or not, okay, they can't express. Even they are feeling pleasure, they don't express. Even if they are not getting any pleasure out of doing things, they don't express. Right? First important thing is self-compassion and accepting, okay, the self. So generating attitude of care, warmth, self-acceptance. Individuals create an internal environment of safety that I am adequate, I can do well, it's okay, sometimes I may fail, but I am learning. These are important things. Okay, right? I'm doing better. So this increases a positive self-esteem builds through self-compassion. This allows emotional openness, build relationship, become very close to partners, and it leads to sexual outcomes to emerge more naturally. Uh, I have only very few slides left.
Yeah, no problem. No problem.
Oh,
You can go.
okay.
Take your time. Not issue, sir.
Okay. Arch surfing. When we kind of sit on the beach, watch waves, it's very beautiful, right? So a wave gradually goes to a peak and it falls. So it rises and falls. So thoughts are something like that. In art surfing, it's a technique where, like you see, we train the clients to remain present with whatever the intense sensations, urges, or anxiety without immediately reacting through avoidance, control, or compulsion. We ask them to wait. Whenever there is some negative thought or negative emotion that rises, rather than acting out immediately on those thoughts, we ask them to wait, calm down, be present. It is only a peak which is rising, but it will fall. Individuals learn that these experiences are temporary and tolerable. Okay, for clients with erectile dysfunction or vaginismus, what happens is, like you see, as they start being little intimate with their partners, they may tune to their partners, there is some stimulation coming in, they feel little aroused, but some trauma strikes of past, because mind, we cannot really have a kind of boundary. Okay, I am in this task, I don't want these thoughts. We cannot separate that thoughts. That will intrude naturally. When these thoughts intrude naturally, we ask the clients to wait. Don't act on it immediately. Don't jump to engage with those thoughts. Don't try to drive those thoughts away. Just wait. That will fall. Okay, and be tuned to what is happening. Okay, right? You are in this act, so you be present on that task only. So by this, we help the client to tolerate this distress. and we educate the client, it is only a temporary thing which is happening. So this increases self-regulation, reduces fear of arousal, loss of control, and being emotionally overwhelmed. Over the period, individuals develop confidence in their own ability. Okay, this may go, it will come back. Let me stick to this act. Okay, I can do well. And day by day, minute by minute, they progress. They could maintain their erections, or they could delay their ejaculations, or perform to their satisfaction. So this helped them to stay with the experience without being driven by it. Thoughts are very powerful. In a split second, they intrude, they storm our mind. We help the clients to be very aware of these thought processes and say that it is only a rising, like you see, wave or a tide, and it will collapse in a couple of minutes. Then, mindful exposure to sexual experience. Most clients, when they have failures, they avoid certain aspects of sexual life. Okay, right? They fear, out of fear. Okay, maybe doing certain things. No, 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 not today. Okay, so these are very frequent complaints. When these kind of things are there, mindful exposure will help them to maintain present moment awareness and emotional safety. This can be done through helping the clients being aware of increasingly intimate situations, graded way, gradually. Okay. Okay. For example, for the clients with vaginismus or dyspareunia, pain-related conditions. Okay. The moment they start thinking about penetration, sympathetic activation happens. So instead of, like you see, causing the clients to instead of avoiding these things, client can approach these things in a graded way. Okay, gradually being with husband, allowing to touch. Okay, sometimes sensate focus methods. Okay, just to resolve that sexual anxieties first, not to avoid. Okay, maybe it can be started with genital contact, maybe doing something pleasurable, rubbing, and gradually experiencing dilation, okay, and lubrication, okay, and in a graded way, not with a target of achieving penetration, but in a graded way, and helping the client to observe the sensations, have a body scan, relax the muscles, okay, and engage in the present. This way reduces fear by desensitization, builds trust that the person is capable to tolerate. It is not all that difficult what I thought. Okay, they can tolerate the vulnerability, and it will increase their closeness. So it is a very powerful tool, mindful exposure, because avoidance will reinforce, okay, in not happening worse things. So expecting worse things to happen, if they encounter, if they participate in sex, clients avoid participating in sex. Avoiding participating in sex will lead to a natural relief because there are no more failures. That negatively reinforces this whole cycle. Mindful exposure will help them to break that cycle, desensitize, deal with their pain and trauma in a better way, and become associated well with the sexual contact. Then, most important thing out of all is communication. Okay, right? This plays a very powerful role in shaping relationships. Okay, just by a word, we can make a person happy. Just by a word, we can, like you see, poke very deeply into their heart. Right? So, mindful communication should be taught to every client, because only then they can talk in a way which can lead to a pleasant outcomes. I'm treating a client Wife and husband. Husband has erectile dysfunction. This is another couple. Husband is a banker. He's in a very senior position, and wife is a, like you say, she's an anesthetist. So the problem is husband's erectile failures. She is little cutthroat when she speaks. She's very cutthroat. Okay, what happened? Why you did not watch these movies? She says, like you say, why you are feeling like this? I told you, no, you go and watch those movies. What happened? Why you did not watch? This communication doesn't help. Husband felt overly demanding, overly anxious, avoiding. Okay, so this will only lead to more and more distressing communications. Mindful communication is about strengthening emotional attunement. What is that your partner going through? Understand and listen to the partner. Speak with full presence, without defensiveness, without being overly bossy, or without being very demanding. Okay. If this can be told in a very pleasant way, okay, this can be told in a pleasant way. I have another couple, wife and husband with erectile failures. 10 years, they are not taking any treatment. They have not taken a single consultation. They have totally avoided sex for 10 years. He attempts once in a while. Whenever he fails, wife says, it's okay, no problem. This happens. All right, we can try in better ways. There is help you can take. Okay, right? So that is how she kind of talks to him. And after 10 years, this gentleman came for therapy just because of her, the way she is communicating. And for this person, for the other person where wife is very demanding and very rude in communications, he says, sir, when she speaks like this, I even don't feel like going to her. Why should I kind of take all this stress? She is not understanding. When she is speaking like this, I am emotionally hurt. Okay, which is kind of causing me to lose every time. When he says this, please speak little calmly. When you speak like this, I am losing all this. Okay, right? She says, if you are capable, you will sustain it. Very harsh. So partners should learn to express their internal thought processes clearly in such a way that receiver, like you see, the other partner can accept it openly, take it as a feedback and can work on it. This can reduce misunderstanding, blame, withdrawal, and it will foster a sense of being understood. Okay, right? My worries are understood. My partner is supportive. When such way of communication happens, then it will foster the progress. So it creates a very safe relationship, supports intimacy, cooperation, and healing. Mindfulness can be integrated with sensate focus approaches. Sensate focus is always, it is again about being in the present moment again, focusing on the senses. It emphasizes shift from achieving outcomes to exploring experience. Just experience what is going on, not about where it is going to lead to. This focuses on present rather than performance, how I am doing rather than being a spectator. It focuses on sensations rather than results, focuses on curiosity, okay, to participate rather than being evaluated or evaluating themselves. So, applying mindfulness in sensate focus transforms it into a deeply relational and embodied practice that can support trust, playfulness, and disconnection. Sexuality becomes a shared exploration rather than a task to be completed or a problem to be solved when there is mindfulness in partners. And relationship and its well-being is very important. Mindfulness emphasizes, and when they use mindfulness methods, it enhances empathy and emotional attunement of the partners. It improves body image and sexual self-acceptance, and it creates a safety, a kind of sense of safety in vulnerability, because they are learning and they have supportive partners with them. They learn that safety go in vulnerable times, in being intimate, and it deepens emotional and sexual connection, okay, with their partners. So to conclude, mindfulness reframes sexual dysfunctions not as a defect of body, but as a disruption of awareness, safety, and relationship with oneself. By cultivating being in present, acceptance, compassion, and embodied engagement, mindfulness allows sexual functioning to reorganize naturally and emerge more organically. It shifts the therapeutic focus from performance to presence, from control to connection, and from fear to openness. In doing so, mindfulness offers not only a method of managing sexual dysfunctions, but as a pathway towards deeper intimacy, pleasure, and relational fulfillment. Okay. A mindful thank you.
Rama?
Yes, sir. Any questions, Neetu?
Yeah, there are questions, ma'am, and I'm posting it here.
Yeah.
Wait a
Yeah,
second.
please.
Before you
Just
start
wait.
the question from audience, let me have my doubts to clear.
Please,
Sir,
please.
this mindfulness is only useful in psychological cases of sexual dysfunction, or it is helpful in all type of sexual dysfunction?
In all types of sexual dysfunctions, because mind and body, they are united.
Good evening,
Sex is
everyone.
not just about body. Mind, the presence of mind tunes the responses of the body.
Hmm.
So it is very important. There may be organic conditions,
Hmm.
client may be going through organic issues
Hmm.
or physiological problems, okay, for which they may be having erectile dysfunction or pain conditions and so on. And even in those conditions, it can help because that will reduce that trauma, that will help them to reorient in a better way to their problems. So it can be used in organic conditions also,
Yeah,
sir.
so it is as a primary treatment, or it can be adjuvant treatment to something else.
It can be both, sir. It can be primarily mindfulness based, or it can be as an adjunct to other methods of solution focused approaches. Or if there is some interpersonal problem, you are doing interpersonal psychotherapy. At the same time, you can integrate mindfulness approaches as and when they are needed.
Mhm.
So you
So,
can integrate.
so how will you decide which therapy to offer to which patient? Is there on which basis you will select the patient? This patient will be more useful if they practice a CBT or sensor focus or mindfulness. How will you we can decide that?
It is based on their psychological mindedness and how really they are oriented towards this psychological, like you see, how do they understand the whole thing, insight we call. Okay, what is their level of insight? What is their level of intelligence? When we there is a psychodiagnostic assessment what we do in few clients to understand, because primarily the problem may be avoidance.
Mm.
Okay, wife is avoiding sexual encounter. Okay, not letting husband to come close. So these kind of problems are very frequent.
Mm.
So naturally, any gynecologist may think she may be having some vaginismus or some, like you see, problem in kind of like you see lubrication and all these causing pain. So people generally, like you see, I don't know how this practice happens fully. I'm not fully aware, but generally a prescription is made to deal with it. But person also need to be intelligent to understand it. I have clients who come with intelligence issues, intellectual disabilities. They don't look so, they don't look any abnormal. They are just like all of us, but they have problem in understanding, in comprehending. They don't really understand these desires in a better way, how to connect with partner in a better way. So most cases I do a psychodiagnostic assessment to understand the nature of the problem first. If it is intelligence problem, then educational approaches will help. What is marriage? What is sex? Because their awareness is low. And if the problem is because of anxiety, okay, there are a few clients whose personalities are very prone to anxiety. They keep on worrying. They keep on ruminating. They bring all the past. They put in front of them. They keep on dissecting. Okay, they keep on doing a postmortem by postmortem of those thoughts. What happens is, as and when the clients do this repetitively, they experience the same trauma. They go through the same trauma. Okay, so we help the client to deal with their thoughts in a better way. If it is anxiety is the core thing, anxious preoccupation is the core thing, then we help the clients to deal with their anxious nature in their personality in a better way. And then we kind of like, you see, call couple for therapy together so that we can introduce this mindfulness, sunset focus, and so on. So there are many conditions based on that we take the approach. It's mostly eclectic, depending on client to client and their needs.
Okay. And one more thing, sir. It is a mindfulness is a individual therapy or it is a couple therapy? How do you approach?
It is both, sir.
Okay.
It is individual when it comes to their own personal experiences. Okay. And when it comes to communication, being intimate, practicing sensate focus, and all, couple. So we kind of like, you see, take both. It is both actually.
Okay. So you described various technique of mindfulness. So how you decide which technique to use it with patients, sir?
So it is depending on where their attention is going.
Okay.
Okay, where their attention is going. If their attention is going to the physiological arousal, I am feeling panic, I am feeling palpitations, right? So then breathing technique will help. If the muscle tightness is the condition, then body scans will help. If anxious preoccupation is the problem, then we will help them to kind of like, you see, monitoring the thoughts. That will help. Arch surfing will help. So depending on the nature of the problem they are going through, we recommend them this.
Okay. So you mentioned about the sir body scan. So does it body scan will lead to the body monitoring because we are observing the body parts now. So it will be creating more problem or not?
This is mindful body scan.
Okay.
When patients are in their own anxious mode, when they scan their body, they will notice palpitations, tightness. Okay, sometimes they shiver. All these things they notice. But mindful body scan, we help the client, we orient them, okay, we tune them that thought processes are generating these reactions. Okay, so you see them as a cognitive event. Don't engage with these thoughts, let them pass, and you work on the body, you scan, and you release the tightness. Okay, and gradually this fades away, cognitive activity fades away, and body will gain a suitable condition, a compatible condition for being intimate.
And sir, you said about the open monitoring. So it is the same thing as pranayam, or it is different? Open monitoring is different technique.
Monitoring of thoughts and emotions. This is like, you see how these thoughts are surfacing, and these are only transient. You see, most clients, what happens is the moment they have thought, they will jump and they get engaged with that thought. When they engage with that thought, it will lead to a whole lot of reaction in the body, and it will spin the wheel, the negative thought cycle. Okay, so open monitoring will help the clients to understand it is only a mental activity, okay, which is transient. It will only stay for a while, like in arch surfing. We'll just wait, let it go away. It is not true. It is only an event in mind. So this is monitoring, sir.
Okay. And sir, sensory grounding is same as sensor focuses, or there is something added on sensory grounding?
Sensory grounding is, like you see, is the technique used in sensate focus approach
Mm.
initially to
Mm.
experience, to be in the present. So the first very step is, like you see, the sensual touch.
Mm.
Partners are asked in the sensate focus to participate in sensual touching, mutual touching, right? So when they do that, okay, we ask the client, it is only nothing but the sensory process happening. So only focus on how do you feel when you are being touched? How do you feel when you partner, when you touch your partner? So sensate focus involves this sensory experiences, like focusing on this sensory experiences only, but that will gradually change the gear towards penetrative sex. For clients who have problem in arousal, in achieving arousals, this grounding, sensory grounding will help. Hence, that is the first step in sensate focus also.
Okay. So both are same, more or like.
This is the first step. Sensory grounding is the first step in sensate focus.
Okay. Yes, Amma.
So first of all, it was very wonderful deliberation on mindfulness, and it shows your massive experience with variety of patients with various sexual dysfunctions, sir. So now people are have few questions. Like first question is like, how do you counsel patients who are skeptical or dismissive of mindfulness as a therapeutic tool? They want to know that how you
If
will
we
just
rule out
counsel.
what is left, okay, I would just, like you say, I want to ask a question before I answer this. If you rule out mind, okay, what is left?
Nothing.
Right? So there is nothing left, right? Presence of mind is very important. For example, for all of us to participate in this talk today, maybe your phones are ringing, somebody is coming and distracting, right? All these things probably happening simultaneously, right? It is our choice whether to be in the present in this lecture or to be distracted by that. Once the client understands this, if therapist is able to explain this in a better way to the clients, okay, they will understand it and they participate more enthusiastically. So they need to understand the core concept in a better way. It is
Right.
not that a prescription right away. We do a psychoeducation, okay, the mind and body connection, how it happens, right? How thoughts will lead to certain emotional changes, physiological changes, how this threat, flight or fight mechanism works. When they understand it, there is no reason for them to deny, because this is the only way. Even if you use CBT methods, probably in the previous lecture, this is the only way. Tune our mind to present. Okay, so this is what we have to help the client to understand, and they accept it. Most clients, they accept it.
Until unless they are they have understood already, so they are before you, they're presenting before you.
They understand it, because once doctors say it is psychogenic, it is psychological, nothing physiological. You go and see a psychologist or psychiatrist. Okay, they acknowledge it, but still the insight may vary. They may think I have these psychogenic issues because of my partner, because of certain other things. Okay, but here we help them to orient towards their own reactions to the thoughts. What is, how are they internally engaged? That internal dialogue, what happens in mind, that is very powerful. There may be a number of things happening around us, but what is happening in reaction to all those things in our mind, that shapes our response. So we help the client to understand that, right? So once they agree, they participate very beautifully in the therapy.
Okay. Okay. So
Yeah.
the next
Any
question is like
questions?
in patients with coexisting anxiety. Sir,
Please go ahead.
next question, sir.
Yeah,
Yes.
please go ahead.
Patients with coexisting anxiety, depression, or relationship distress, should we initiate mindfulness first or stabilize the psychiatric condition pharmacologically?
There is a judgment that clinician should take. Is it a disorder, pathological, or situational? If it is pathological, I have a client with OCD, obsessive compulsive disorder. Okay, she has, like you see, fear of contamination of her own bodily fluids, that she would contaminate the surroundings, okay, through sweat or through, like you see, when she's speaking, okay, right, you see, the saliva may spill over, or by bodily fluids when she's using toilet, and genital secretions during lubrication and sex. So she has active avoidance. She kind of avoids all these things. Okay, all sexual act, because the moment she gets aroused, she sees lubrication as a source of fear of contamination, and she avoids. Okay, so in those kind of conditions, treating the psychiatric condition is very important because it is a disorder. If they are only at apprehension levels, only at situational level, you can straight away go with sex therapy, mindfulness based approaches, and all. But if there is an underlying condition which is leading as a symptom, you see, sexual dysfunction can also be the result of a psychiatric condition. In the recent CSCPI conference, I have presented on the same. The other way, everybody thinks sexual dysfunction will lead to depression, anxiety, panic, and all that. But looking it from the other way, psychologist lens, how sexual dysfunction can also be a symptom of a psychiatric condition. If that is the symptom of a psychiatric condition, that have to be treated through that. After that, if symptoms still exist, then treat. In most cases, because they are secondary, they go away with primary CBTs or pharmacological management and so on.
Sir, I have read somewhere that difference between the sensate focus and mindfulness is basically sensate focus require partner, while mindfulness is a you can do as a monotherapy or solo therapy. Is it true or
It is both. That's what I said, sir. It is
okay?
both. Because now, when partner, you see, if husband has erectile dysfunction, for suppose,
Mm,
okay, so the direct party who is affected is wife.
mm,
They have their own things to deal with. They may be feeling deprived. They feel victim.
mm.
There's a lot of stress. They communicate that stress in a very distressing way, right? So all those things happen. So now partner should also understand it is only when they both tune to each other's mindset they can make it happen. It is not husband can, it is something like this, sir. If there is only water, we can learn swimming.
Mm.
Only when there is a partner, okay, right? Patients with failed encounters can relearn and do well. No partner, if recently a person came, my wife said, you go and get treated, she don't want to come. So now where is this guy going to practice? Because when he fails, there is a disappointment in wife. Wife should know how to mediate her responses also in that condition. So when she responds in appropriate way, he will feel accepted, feel supported. Then they can naturally bond well. His apprehensions, his anxieties will gradually resolve also, right? So that is where I definitely recommend including partners, because partners should also know. And when partners know that these people are putting efforts, okay, and the feedback what partners give will also foster their progress. If they say, yeah, I felt better, that will kind of create a positive cycle. They come out of these apprehensions and a positive thought cycle that starts, that I'm doing better. A positive self-concept is established. They may be no more self-blaming or self-critical. Right? So there are a lot of benefits of doing it. And it is essential also. We cannot do sex therapy through any methods of psychotherapy without partner.
Yes. And sir, basically, in infertility cases, basically, particularly, there is a lot of sometimes happens now. We ask a couple to have a intercourse during specific days, 13 day, 14 day. We tell them that tonight you have to take the sexual intercourse. But due to performance anxiety, there are so many issues during that period. So how will you tackle with mindfulness?
So that is through the breathing training, relaxation methods, body scan methods. So the same things, sir, what we have discussed. Okay. So we will help them to reorient themselves to resolve their anxieties. Okay. So when they understand negative thought cycle is activating sympathetic arousal. Okay. And body scan, breathing awareness. Okay. And all other mindfulness techniques can resolve this and activate parasympathetic, okay, system, which is conducive. So when they have this knowledge, because they lack this knowledge essentially, most clients, they lack this knowledge into thought, the mind and body. Only what they know is it is working well or it is not working well. But what is mediating that, they are not aware. So sex therapy is mostly educative. You help the clients to learn more into their thoughts, more into their physiological responses and reactions, and gradually shape into suitable conditions.
Yeah.
So that's how it is, sir.
Yeah, so basically, due to anxiety and its problem in such type of patient is okay, but sometimes it become too mechanical because it is a their main focus will be on the intimacy. It will be more about the being pregnant to get pregnant. So there are so many issues because of that. So how will you deal with mindfulness?
This is
Be
also
helpful to such
increasing,
cases
sir.
or not?
This is also increasing. Okay, one of my friends, they have like infertility clinic, and
Mm,
they run an IVF center.
mm,
Okay, right? I got a couple who are very happy. They have one child through IVF. Okay, they never had any, like you see, penetrative sex. The child is around 10 years. They both have schizoid personality.
mm,
Both wife and husband, they have schizoid personality. They are less bonded. Their sexual desire is low. Okay, empathy, attachment needs are very less. But they appear very mechanical. Okay,
mm.
right? So they have child through IVF, right? So this is an increasing scenario also. Okay, for different reasons. Okay, what you need is a child, so we will address that issue. Okay,
Mm.
but if the client's need is working on intimacy, then we should definitely recommend Ruby, because it is only to be learned, sir. Sexual behavior can be learned. Okay, what is adaptive, that can be learned. But despite in this present generation, it is not openly spoke, it is not openly discussed,
Mm.
right? In families and all, when there is a problem, everybody keeps quiet. Okay, so then it becomes difficult to address. If they are open to it, yeah, like any other organ in our body, our mind and our sexual functioning, when people see those things the same way, they take help and they overcome these issues.
Tama, is there any other question?
Yes, sir. Actually, people want to know that in some endocrine issues like diabetes and hypogonadism, sometimes they will have sexual dysfunction. So they are asking that does mindfulness add measurable benefit, or mindfulness will be should be reserved for psychogenic components only?
That's what I said. It can be as an adjunct in the therapy. You can use it as an adjunct in the therapy because there may be a physiological failure, but as patient fails, they learn it. They become distrustful. All these things will, like you see, all these failure encounters are carried. Maybe with treatment they get better, but their apprehensions and worries they remain. So therapy can address those part so that treatment can cure whatever the underlying organic issues, and therapy can help them to come out of their negative thought cycles so that they can relate better and have a healthy life.
Actually, you have explained the next answer. So maybe one more time, if you can say,
Please,
suppose
sorry.
one partner is motivated and other is not, how do you approach therapy planning?
Mm, okay. So then I just keep this mindfulness little away and I'll start working from solution focused method. Okay, there is
Which
another intervention called solution focused method.
okay.
Okay, solution focused interventions. So that is a beautiful intervention method. Okay, rather than I decide what should happen, I will leave it to the clients by asking, okay, as a consequence of coming to this session or being in this session, how you want it to benefit you. Okay, right, how you want it to benefit you. Then wife may have some concern, husband may have contradictory idea. She thinks I am not fit, but I don't think so. I have no problem. I'm okay being whatever I am. Okay. So if the husband is stubborn, if they are not acknowledging the problem, then we will steer this conversations through solution focused method by asking, okay, you feel that you are okay, you are adequate. How is that your partner can know that you see you are also adequate and you are feeling good? How is that your partner can know? Then the client have to answer to this. Clients will answer to it. Yes, only when, like you see, we have some weekly times where we are little intimate. Okay, then I'll ask wife,